All right, let's jump right in. We've got a stack of medical journal articles here, all about amenorrhea. It's one of those topics, that people might shy away from discussing, but it's actually more common than many realize.
What I find fascinating is how often people think about their menstrual cycle as this, separate thing,
Right.
when it's actually giving us all these clues about our overall health. It's a vital sign, just like your pulse or temperature.
It's like a monthly check-in with your body.
Exactly.
A little status update from your own personal health dashboard. Okay, so before we get into the nitty-gritty of why periods go missing, let's define what we mean by amenorrhea. Because we've got primary amenorrhea and secondary amenorrhea. What's the difference?
So think of it this way. Primary amenorrhea is when someone hasn't started their period by the time they turn 15. It's like the body hasn't gotten the memo to kick off that whole cycle.
Okay.
Secondary amenorrhea, though, that's when periods just stop after they've already been happening. We're talking at least 3 cycles missed in a row, or 6 months without a period.
So it's not just a late period here or there. It's a pattern, a signal that something might be off, like that check engine light flashing on your dashboard. It might not be a crisis, but you're definitely going to want to figure out what's going on.
Absolutely. You want to get that checked out. And that's really what we're aiming for today, equipping you with the knowledge to understand what those flashing lights could mean. Because whether you're personally dealing with amenorrhea or just super curious about it, understanding this condition is, it's powerful.
Absolutely. And to get there, we have to talk about hormones, right? I'm already seeing mentions of GnRH, FSH, estrogen. It's like a whole other language sometimes.
It is a bit of a mouthful, isn't it?
Can you give us a quick breakdown? How do these hormones all work together in the menstrual cycle? Is it a chain reaction?
I like that analogy. So picture GnRH as the messenger. It's sent from the hypothalamus in the brain to the pituitary gland. That's another crucial control center. And then the pituitary, it releases FSH and LH, which are like the directors, signaling the ovaries to start producing estrogen.
Okay.
Estrogen then does its thing, thickening the uterine lining, prepping for a possible pregnancy. If pregnancy doesn't happen, those hormone levels drop, the lining sheds, and bam, period time.
It's like this perfectly choreographed dance, each hormone playing its part. But what happens when one of those dancers is out of step? Is that where we get amenorrhea?
You got it. And just like a missing dancer can mess up a whole performance, even a tiny hormonal imbalance can have these ripple effects throughout your body. Because remember, the menstrual cycle isn't just about getting pregnant or not. It affects bone health, heart health, metabolism. It's all connected.
It's all related. So many moving parts, so many places where things could go off track. But let's talk about what those are. What are the most common culprits behind amenorrhea? Those things that can disrupt this delicate hormonal dance?
Well, it's a bit like detective work, isn't it? We've got our lineup of usual suspects. And sometimes you have to dig a little deeper to find the real culprit. But let's start with those common culprits. One major category is what we call ovarian factors, problems with the ovaries themselves.
The ovaries, the hormone powerhouses. So what could be going on there that would cause periods to go MIA?
Well, one possibility is something called premature ovarian insufficiency, or POI for short. And it's basically like early menopause.
Oh, wow.
It's not as common, but it can happen, even in your 20s or 30s. Essentially, the ovaries just decide to retire early.
Early retirement for the ovaries. That sounds intense. I can only imagine what our listeners are thinking right now. Fertility has got to be a big concern there.
You're right. That's a huge concern for women diagnosed with POI. And while it can definitely make it more difficult to get pregnant, it doesn't always mean infertility. There are treatment options, and, the outcomes vary from person to person. It really all depends on the individual and what's causing the POI in the first place.
So definitely not one size fits all, and a good time to loop in your doctor to talk through those concerns and options.
Absolutely, 100%. Now, another pretty common culprit that also hangs out in the ovaries is polycystic ovary syndrome, or PCOS.
PCOS, yep.
This one's a bit more common than POI, and it has a lot to do with insulin resistance.
PCOS, I've heard of that, but it's easy to get these things mixed up. To keep things clear for our listeners, could you break down the main difference between PCOS and POI?
Yeah, great question. Because they both can lead to amenorrhea, but they're very different conditions. So think of PCOS like this. The ovaries are a bit overenthusiastic. They might be larger than usual with multiple small cysts, and they often produce higher levels of androgens, which are male hormones. POI, on the other hand, is more like we talked about the ovaries calling it quits early, leading to those lower estrogen levels.
Okay, so PCOS, the ovaries are working overtime, maybe a little too enthusiastically.
Mm,
And POI, it's more of that early retirement situation, both impacting the menstrual cycle, but in very different ways. That's helpful.
exactly. Now let's shift gears a bit. We've been talking about the ovaries, but sometimes the root of the problem actually lies further north in the brain.
Oh,
Because sometimes it's all about how the brain is communicating, or maybe not communicating so well, with those hormone powerhouses.
investigating the command center. Okay, what's happening in the brain that could lead to missed periods?
So there's this region in the brain called the hypothalamus, and you can think of it like the conductor of an orchestra, sending out these perfectly timed signals to the ovaries, telling them when to start and stop producing hormones.
Okay.
But if the conductor gets, like, flustered or something, the whole symphony can go haywire. And that's where hypothalamic amenorrhea comes in.
A flustered conductor. I like that analogy. So what kinds of things can fluster the hypothalamus and mess with that delicate signaling system? Is it like stress messing with the conductor's tempo?
Stress is a big one, yeah. It's like the hypothalamus is wired to prioritize survival above all else. So if it senses you're under a lot of stress, it can hit the pause button on functions it sees as less essential in the moment, like reproduction.
Makes sense.
Yeah.
Body's like, we're in survival mode here. No time for baby making.
Exactly. But it's not just psychological stress, you know. The body can also interpret things like having very low body fat or extreme dieting as stressors, too.
Right.
And actually, a lot of the research you shared highlighted how even if someone isn't clinically underweight, restricting calories too severely or exercising intensely, it can really disrupt that hormonal balance you need for a regular cycle.
It's not just about being thin or fit. It's about fueling your body properly. And this is why, working with a doctor or a registered dietitian is so important, especially if you're aiming for weight loss or you've got these intense fitness goals. They can help you find that sweet spot where you're healthy and your cycle is happy.
I totally agree. Now, we've talked about hormonal causes, things stemming from the ovaries and the brain, but sometimes the reason for amenorrhea is honestly a lot more straightforward, almost like, a simple blockage.
Interesting. Okay, so less of a complex hormonal mystery, more like a wrong turn down a one-way street. Tell me more about these physical or anatomical causes.
So we've covered a lot of ground, from those over-enthusiastic ovaries to those stressed-out conductors in the brain. But we're not done with our detective work yet, are we?
Not quite. We've tackled those more common suspects, but these articles you've got here, they also point to some rarer causes of amenorrhea, cases where we really have to put on our deerstalker hats and, search for clues.
Ooh, intriguing. I'm ready to channel my inner Sherlock. What are some of those more unusual suspects we should be on the lookout for? Well, one fascinating avenue is genetics. Sometimes the answer to why someone isn't menstruating is hidden right there in their DNA.
Genetics, that makes sense. I mean, we've been talking about how hormones are running this whole show, and our genes are like the blueprints for how our bodies produce and use those hormones. What are some examples of genetic conditions that could lead to amenorrhea?
One you might have heard of is Turner syndrome.
Okay.
In this case, a female is born with only one complete X chromosome instead of the usual two. And this can lead to a whole range of developmental differences, including, you guessed it, how the ovaries develop and function.
So if the ovaries aren't getting the right instructions from those genes, it can impact their ability to produce hormones, regulate the cycle. That's a lot to process. What kind of support is out there for women with Turner syndrome?
It's definitely a journey. Early diagnosis is so important, and treatment often involves hormone therapy to help kickstart puberty, manage symptoms. There's also a big focus on managing other health issues that can sometimes come along with Turner syndrome, things like heart or kidney problems. Mm-hmm. And of course, support groups, online communities, those can be incredibly helpful too for women and their families as they navigate the challenges and, the triumphs of living with this condition.
Absolutely. Such a good point. It's a good reminder that behind every diagnosis, there's a whole story, a person living their life navigating those challenges. Thanks for sharing that perspective. Are there other genetic conditions that we should know about, to help us in our detective work here?
Another really interesting one is androgen insensitivity syndrome. Mm-hmm. In this case, a person is genetically male, meaning they have an XY chromosome pair, but their body doesn't respond to androgens, those hormones we typically associate with male characteristics.
So even though they have XY chromosomes, their body doesn't quite follow that typical male developmental path.
Exactly. They might develop as female externally
Yeah.
and often don't even realize they have this condition until maybe they experience amenorrhea, as their internal reproductive organs haven't developed typically.
Wow, that's a really powerful example of how complex sex development really is. It's not always as straightforward as just looking at chromosomes, is it? These genetic conditions sound like they require really specialized care.
Absolutely. And it really highlights how important open communication with your doctor is. If you're experiencing amenorrhea, you know, don't hesitate to bring up any family history of genetic conditions or anything else that's concerning you.
Yeah, right. Knowledge is power. And the more information you have, the better you're able to advocate for your own health. Now, moving past these genetic factors, are there any other, maybe less common causes of amenorrhea that we should have on our radar?
Yeah. We can't forget about the pituitary gland,
Right.
that little pea-sized powerhouse in the brain that releases several key hormones, including some that directly impact the menstrual cycle. If the pituitary gland isn't functioning optimally, maybe due to a benign tumor called a prolactinoma, that can definitely lead to amenorrhea.
The pituitary, always the overachiever,
Yeah.
involved in so many bodily functions. So if someone suspects a pituitary issue, how would that be diagnosed?
Blood tests are often the first step. Checking levels of prolactin, for example, can be a telltale sign. And then, depending on those findings, your doctor might recommend imaging, like an MRI, to get a clearer picture of what's happening.
It is amazing how interconnected everything is, from the brain to the ovaries and back again. This deep dive has really been eye-opening for me, seeing the complexity of the menstrual cycle and all the factors that can influence it. But I think most importantly, what are the key takeaways you want our listeners to walk away with today?
I think the biggest one is that amenorrhea, while it can definitely be concerning, it's often very manageable. It's not something to be ashamed of or to ignore. By understanding those potential causes, the common ones and the rare ones, and by working with a healthcare provider, you can absolutely get the answers and the support you need to regain control of your health.
That is such a powerful message, being proactive, listening to your body, advocating for yourself. Whether you're experiencing amenorrhea firsthand or you just want to be more informed, knowledge is key. And if there's one thing this deep dive has provided, it's definitely a wealth of knowledge, demystifying a topic that's often, kept in the shadows.
Couldn't have said it better myself.
Well, on that note, a huge thank you to you, our expert, for walking us through all of these fascinating studies, and to you, dear listener, for joining us on this deep dive into the world of amenorrhea. Until next time, stay curious, stay informed, and keep those questions coming.